Hello class and welcome to week 8 of Abnormal Psychology. This lecture video will serve the purpose as reviewing your week 8 materials and talking about the capstone. So let's jump right in. Last week we talked a lot about the capstone, but of course I want to talk a little bit more about it this week. I won't spend too much time on the materials because this week is rather short. Just a reminder that the capstone is due on Thursday, day 4 of the week 8. So just be mindful of that so you can submit your assignment on time. And you do have to submit it in 2 places. And also, like I mentioned last week, I am giving extra credit for the eval. So if you take your eval, send me a screenshot of your completed evaluation, and I will apply extra credit to your final score. Or if there's a specific place that you would like me to put the points, I will put them there, whether that's on an exam, an essay, or anything like that. Wherever you want me to put the points, just be mindful to add that into the email once you submit the screenshot so I know exactly where you want your points. So let's jump right in. So this week is fairly short. All your assignments will be due on day 4. So you will be reading chapters 15 and 16 over neurocognitive disorders, legal, ethical, and professional issues. Excuse me. So those are the 2 main components for this week. And then you have your discussion board. That is also due on day 4. So just be mindful this is due Thursday midnight. So you'll have to write in no less than 250 words, of course, discussing the content for this week. And then lastly, your capstone. So I spent quite a bit of time talking about the capstone last time. So if you need a more in-depth, thorough discussion, check out week 7 if you haven't already. Excuse me, I have the hiccups. But anyways, moving forward. So like I said before, this essay is worth 200 points, and it's quite similar to the essays that we've had in the past. But the only difference is it needs quite a bit more thorough detail and information because it is a capstone final project. So I am looking for a minimum of 6 to 7 pages in length. And if you go over that, then that's perfectly fine because that's what I'm looking for. I need a lot of thorough information. And a few people received feedback in terms of their last papers of it not being as thorough and things like that. So just be sure that you are being very thorough on each component of this assignment. So, and also for this assignment, you'll need to submit it in 2 places. So you'll submit it in Blackboard, and that's just going to be your plagiarism checker. It's going to check to see if there's any similarity between sources and things like that. So be mindful whenever you are citing your sources that you are rephrasing and paraphrasing the work that you are using. And then you'll also submit it in task stream, which is where I will grade your paper. So that is very important. You do have to submit that in both places, so just be mindful of that. You'll also need to be using a minimum of 6 peer-reviewed sources, no websites, and also that does not include your textbook. So if you would like to use your textbook, you still need to have 6 peer-reviewed sources to count towards your total number of references. And similar to other papers, you'll still need your subheaders and things like that. So like I mentioned before, there's a lot of detail on what I'm looking for in terms of your capstone on the week 7 lecture if you have not watched that already. So with that being said, here's your assignment instructions in terms of how to submit them on task stream and things like that. So with that being said, I think I want to focus a little bit on some of the material for week 8. But like I said, if you have any questions, comments, concerns for the capstones, please email me. Don't hesitate to email me. I am readily available and I will answer you quickly. You also have I'm sorry, you don't have a vignette this week, but your discussion board will be an interesting topic too as well. So I'm interested to see what you guys think on this discussion board. And you did a great job overall throughout the course of writing some great stuff for each discussion board. So I really enjoyed that. So let's jump into some of the material. So the main topic of discussion for this week, of course, is chapter 15 is the neurocognitive disorders, and then chapter 16 is the legal, ethical, professional series of the chapters. So with neurocognitive disorders, the main function, of course, is the brain, and it typically does have a compromised brain function when you think of the symptoms and the things that go on with these disorders. So, of course, there's delirium. Similar to Alzheimer's, it's usually acute, and it also can become a chronic, but it develops fairly rapidly, and the severity can fluctuate just like with Alzheimer's. But it's contributed with, of course, disruptions in the sleep and wake cycle, variations in motor activity, and things like that. So, of course, whenever you think of autism and delirium and neurocognitive disorders, there's plenty of risk factors, whether that's age and sex. Children are at risk during fever, alcohol, medication, or drug abuse use, dementia, sensory impairment, toxins, and damage to the brain. So, let's see. I think I want to jump into Alzheimer's, of course. So Alzheimer's is definitely the most common form of dementia, and it's talked about and discussed more often than other neurocognitive disorders. And of course, with Alzheimer's, it increases with someone's age. So it may start, for instance, maybe it starts at 58, and it'll increase in severity each year as the person gets older. So it's definitely progressive, and it's irreversible dementia. So the diagnosis is made partly by exclusion. So, for instance, if you have a client that comes in that has a loss of memory, is forgetful, and things like that, they'll see what symptoms they have, of course, and then from that they'll determine whether they do have early onset on Alzheimer's and things like that. And of course, memory loss is an early symptom for Alzheimer's. So many questions for concern and analysis in terms of the cause of the disease, because a lot of people do suffer from Alzheimer's. So causes have been linked to chronic deterioration of neurons, familial, genetic and DNA things, and other, I want to say, function within the brain. So you'll see the senile plaques, no fibrillary tangles, things like that. And of course, I always have to mispronounce one thing throughout the presentation. But yes, so of course the treatment for Alzheimer's is rather difficult. So you can't stop or reverse the condition. So the treatment is definitely one of the challenges. Just like with schizophrenia, similar to schizophrenia is hard to treat in terms of therapy-wise. And some of those more severe diagnoses, it's hard to treat someone who is progressively losing their memory and things like that. So what you tell them one day, they may not remember the next. So that's important to recognize. So the form of treatment and therapy for this client will be completely different than someone who has an anxiety disorder or a mood disorder. There's of course medications that can help with cognition. There's drugs that can help reverse plaque buildup. Medication treatment and therapies are all the ones that are used to treat Alzheimer's. So when thinking in terms of treatment and onset and causes and things like that, there's also prevention, which is an increase from over the years. So the preliminary evidence related to nutrition cognitive and behavioral strategies. So those are the main focus in terms of prevention. So having a healthy diet and things like that have been studied to be helpful in terms of prevention. And of course, there's 7 potential areas of risk to reduce the onset of Alzheimer's. So, of course, diabetes is a contributor, midlife hypertension, midlife obesity, physical inactivity, smoking, depression, and educational attainment. So, by reducing these areas of, causes, as you would say, or possible triggers into the development of Alzheimer's, these are the main areas that you need to reduce and prevent in order to prevent Alzheimer's from developing. Let's see. I'm trying to think of any other. Of course, you guys should know about Huntington's disease and Parkinson's disease, but I will address them briefly. So with Huntington's disease, it is a rare disease that's inherited, and it causes the progressive breakdown and degeneration of nerve cells within the brain. So it has a broad impact on a person's functional abilities. It usually results in movements, thinking, mainly cognitive, and psychiatric disorders. Within this disease, they can develop at any time, but there's key triggers and markers for genetic development, and they often appear when people are in their 30s or 40s. So, in terms of this, if the condition does develop before the age of 20, it's called juvenile Huntington's disease. And the symptoms will be somewhat different than if the disease progresses later in life, and they may progress faster. So that's along the lines of the neurocognitive disorders. And with Parkinson's disease, it is also a progressive nervous system disorder that affects movement. And a lot of times people usually call this disorder, or if you see people that have like shakes or tremors, the main, if any of you guys watch Ray Donovan, Terry, the boxer, he has Parkinson's. So he has that, the symptoms for this disorder, they start gradually, and sometimes they're barely noticeable. It could be just, you may have tremors or shakes in one hand, but tremors are common. Most of them, the disorder also has commonly causes with stiffness or slowing of movement. With this disorder, in early stages, your face may show little or no expression. Your arms may not swing when you walk. Your speech may become soft or slurred. With Parkinson's, the symptoms worsen as your condition progresses over time, similar to Alzheimer's and also Huntington's disease. So Huntington's and Parkinson's cannot be cured, but medications might significantly improve your symptoms. And occasionally your doctor may even suggest surgery to regulate certain regions of your brain and to improve your symptoms. So the main areas of focus with Parkinson's are the tremors, slow movements, rigid muscles, impaired posture and balance, loss of automatic movements, and speech changes, as well as writing changes. So those are the main tenets of those two disorders. So yeah, and a lot of times they are diagnosed with of course, the symptoms that develop and some scans that may be able to detect those disorders. So that is all for the neurocognitive. And let's see if there's anything I want to briefly touch on with legal and ethical issues. And this is definitely an important component to psychology and therapy and treatment of clients. So who treats mental disorders? Of course, psychiatrists, clinical psychologists, counseling psychologists, psychiatric nurses and practitioners, and clinical social workers. They all have to be licensed. And here, most of this is just, of course, the laws in terms of how to, of course, maintain legal and ethical guidelines with confidentiality, privilege, duty to warn. Duty to warn is a big one because whenever you are treating clients, say for instance, you have someone who is suicidal or homicidal, that your job as a therapist is to warn maybe the possible victim that the person is trying to harm, maybe the family members that person is suicidal and things like that. So that is very important. And you'll definitely learn a little bit more about this. I don't think this chapter is that big, but it's definitely some interesting components in terms of therapy and what to look out for legal and ethical guidelines standpoint. So yeah, I think that's pretty much all I want to talk to you guys about this week. I wanted to keep it fairly short as always, but this week I really wanted to keep it short because of the significant assignment that you have due on Thursday. So just a reminder, like I mentioned before, the capstone is due Thursday by midnight. I do give a 2-hour grace period, so if you submit your capstone assignment by Thursday or Friday morning by 1:59 a.m., you will be okay. But just remember to get that completed so you aren't missing out on passing this course. And if you have any questions, comments, concerns, please feel free to reach out to me like I said before, and I am ready and available to help you with anything that you are needing. So yeah, I hope you all have a great week, and I really enjoyed working with you all, and hopefully I will see you in another course. If not, I wish you all the best of luck. All right, have a great week.